Everyone, welcome to my channel Ravi Static Physio. So in this series of pharmacology subject, next topic is inflammatory immune disease, and the topic is non-narcotic analgesics. So what is the non-narcotic analgesic, and why we call narcotics, and what is the types? So we are studying in this video. It is very essential for our pharmacology for university examination. So the non-narcotic analgesics are non-opioids. Non-opioids receptors are present in our brain. So if the person is taking the tobacco, cigarette, so if there is addicted or not addiction, it will be depends upon the opioid receptors. So the medication used to control mild to moderate persistent pain and inflammation. So if there is any kind of pain occur in your body which is mild or moderate, so it will be control over there. And the general anesthetics relieves pain by producing unconsciousness. So the narcotics are, it will be relieves pain by producing unconsciousness. So it will be so as like sedation or hypnotic feeling in your relieving pains. And local anesthetics prevent pain by blocking peripheral nerve fibers. So basically the whole body, the generalized pain, so it will be produced unconsciousness to our body. And if there is any kind of local pain, so it will be blocking the nociceptors peripheral nerve fibers into your particular part of your body. They call non-narcotic because they do not act on opioid receptor. It means directly not act on opioid receptors, do not cause addiction and dependence. So basically opioids are non-opioids are not addiction on our body and don't produce euphoria and respiratory depression like opioids. So if there is any kind of pain continuously progressive in our body, so the patient is taking medication continuously, so the patient is not addicted or not dependent in a long duration, but there is side effects, it will be occur, but there is non-addiction will be present in our opioid receptors which is present in our body. The most common drugs belongs to the group is non-steroidal anti-inflammatory drugs, which is NSAIDs. The types are NSAIDs. These reduce pain, fever, inflammation, and by inhibition prostaglandin synthesis and COX enzymes. So prostaglandins are promoting symptoms like rheumatoid tuber collar dollar, like redness, increased temperature, swelling, and loss of function, and heat or like redness into the particular domain in our body. So there is a medication over the counter drug which is not prescribed by doctor, it will be taken by oneself, but make sure if you are long-term exposure of these medications, so prescribed like consult to the doctor, like Ibuprofen, diclofenac, and aspirin. So these medication are taken by the patient, which is over the counter drugs, and it is this kind of medication is not prescribed by the patient is not think to go the doctor and ask for this medication. It will be taken by ourselves without any kind of prescription. So the what is the two kinds of other things are para-amenophenol derivatives. So first is NSAID, second is a para-amenophenol derivatives. It's primarily act as analgesics and antipyretics. So it will be the weak like anti-inflammatory action. So if there is any kind of fever or like severe inflames in our body during the cold or like cough or like the bacterial infection in your body, so during the fever you have taken the Paracetamol or Dolo 650. So these medication help to reduce the prostaglandin activity and decrease the fever after increase the severe temperature in your body to reduce and like kill the bacteria or pathogens in our body. Next is to be selective COX-2 inhibitors. So these medications show the mild to moderate or sometimes the severe conditions such as arthritis and acute injury while consuming the fever gastrointestinal. So any kind of like long duration or chronic pain or injury, so it will be reduce and inhibit the prostaglandin symptoms like such as arthritis and acute injuries by causing fever. Gastrointestinal side effects are like periscorbic and meloxine. So these medication help to inhibit the arthritis symptoms in our body. So there are some drugs where we can use and purpose and which disease. So let's detail about that. So you have to be mentioned this classification of drugs and where we have to prescribe and when we have to use. So make sure about that. We have taken this medication we have before the consultation. after the before the consultation of the doctor. So in the fever, so the medication you have to be use the paracetamol, and the purpose is to be reduce temperature. In osteoarthritis, ibuprofen and diclofenac, you have to know about that, the pain and inflammation reduction. Rheumatoid arthritis, naproxen and diclofenac, it is anti-inflammatory drugs. The muscle pain and sprain, ibuprofen, which is relieve pain in our body. Headache and migraine, you have to be aspirin and paracetamol, which is over-the-counter drug, which is analgesic effect you have to consume in the body. Next is to be dysmenorrhea. In dysmenorrhea, mefenamic acid, it will be release your pain, post-operative pain. If there is any kind of post-operative surgeries in your body, so it will be reduce the pain symptoms, which is example is to be drugs are diclofenac, it is reduce the moderate pain in our body. Cardiovascular prevention, it will any kind of cardiovascular pain in your body, like low dose aspirin. So low dose of aspirin, you have to be reduce the antiplatelet effect in your body and reduce the pain. So indications of these medication: mild to moderate pain, if you have any kind of symptoms, you have pain, body temperature reduction, inflammation, or like analgesic effect, with mild to moderate. You have to be any kind of severity, you have to consult your doctor before taking this medication. In fever, any kind of inflammatory condition, dental pain, and menstrual pain, dysmenorrhea, so you have to be taking this medication. What is the contraindication, which time we have to be not taking this medication of the non-narcotics? So in peptic ulcer and gastric renal failure, so it will be enhance your peptic ulcer if you're taking this medication, because it will be show the action into your like gut or like stomach. So before taking this medication, you have to have any kind of issue in your peptic ulcer disease, and like any kind of symptoms you have to be suffering for this medication, these symptoms, so you have to be consult to the doctor before taking this medication. And also the renal failure, liver disease, because it will be show the first pass metabolism into the liver. So before taking this medication, you have to be consult to the doctor, because the drugs like diclofenac, ibuprofen, and naproxen, so these medication are anti-inflammatory drugs during the like rheumatoid arthritis or like osteoarthritis. So it will be show the first if you're taking the oral route medication, so the bioavailability is to be reduced, because into the liver there is a first pass metabolism you have to be shown, and so it will be reduce the effect in your body. So what is the side effect? The gastric irritation you have to shown in the peptic ulcer, and nausea and vomiting you have to shown peptic ulcer. If there is no any kind of peptic ulcer, so it will be continuously you have taking these medications to show the peptic ulcer disease. Also the GI bleeding occur, fluid retention, reduce kidney function and liver toxicity, increase bleeding, rashes in your skin, and bronchospasm, and increase heart rate. So that is the non-narcotics anti-inflammatory drugs, and the use specific disease and drugs and purpose. So that is for today. Thank you.